Hey guys, this is Kristen Martinez. I'm an expert in trauma-informed care, and today I have makeup on, which is rare. I only do it when I'm doing training. So today I just got here early, so I'm giving a training on how clinicians can work on multidisciplinary teams, which is cool. And obviously, a lot of the reason that we don't do good work with teams is because we are afraid of what that work might bring, and maybe we're not ready to handle it. So today, that's what I want to talk about, is how our own fear of facing difficult issues with clients can affect their outcomes, their treatment, and their ability to, for those of you in community agencies, their ability to exit the system. And so the challenges, and I see it over and over and over again, coaching clinicians or paraprofessionals who are working in this particular area, especially in child welfare, is that we are unwilling to call a spade, to point out the pink elephant in the room, to address the reason why a family might be looking to terminate a placement, or we're afraid to let people know, and families, especially if you work with the foster care system, we are so afraid of telling a foster family about the amount of damage that they'll do by 7-daying a child. And for us here in LA, in Los Angeles, a 7-day is when a family pretty much puts in a removal. And it's not an emergency removal, which would happen immediately, but they're saying, like, get this kid out of my house, pretty much. And as you can imagine, the kind of damage that causes to children, I mean, it's extreme. It's especially to those most affected by the system, who are African American or Black, people who identify as Black, or also the American Indian population here. And so, why do you think that a lot of clinicians aren't willing to face having those conversations with foster families? It's really uncomfortable. It's really uncomfortable to sit down with a foster family and say, look, you accepted this child into your home, and we understand that it's difficult, but any child that you get in this situation is going to have a difficult time because of where they're coming from. They're coming into the system. There's a reason that we're removed from their primary caregivers. And so you really have to say, like, this was expected. It's expected to have children with some behavioral difficulties. And so this is what will happen if you initiate that 7-day. Like, this child will be moved or determined by, many social workers can say that this child is no longer placeable. And if a child is no longer placeable, they're pretty much placed into group homes for long. And that's not a good permanent solution for our children. So you pretty much have to line it up for them, very clear. And I know that's my style is very direct. I'm very much like, look, this is what's going to happen. This is my prognosis if you 7-day this child. If you keep this child, what are the expectations for us working together in the home? Are the behavioral difficulties going to continue? Absolutely. Like, we cannot as clinicians magically make a child better. What we can do is give them the appropriate support, right? Foster parents, I'm going to connect you with resources for you. I'm going to get you in some parenting. I'm going to get you somebody who's connected in the system to kind of walk you through having a child with behavioral difficulties. Does that mean that we may have to shift how you parented and how you parented your own children? Absolutely, because this child's different from your children. They grew up in a different place. They have different needs. And so we really need to start looking at what this child needs and what are the appropriate solutions for our foster families to start supporting our children in those needs. You know, for a lot of you who work in community agencies, it feels hopeless. It feels like no matter what kind of work you do, that these kind of outcomes just keep happening. Children keep getting moved. The trauma keeps happening. And it's really important for us as clinicians, in addition to the good work we're doing, is to be very direct and very forthcoming in our prognosis of what's going to happen after this decision is made. And for a lot of pre-licensed clinicians, and I remember being in this place, you don't feel empowered. You feel like it's out of your scope of practice. And it's not. talking about the effects of trauma is not out of your scope of practice. You're not making recommendations. All you're doing is saying, look, decision A is most likely to lead down this route or this route. Decision B is likely to lead down this route or this route. Decision C might lead you here. And as a clinician, that's our job, because we are the ones who hold all that information. We have the clinical background. We have the knowledge of research. And we really need to lean on our knowledge of behavior, of how things can, especially trauma-related issues, can look going forward, depending on what decisions get made. And so that's what this video is about today. Just take power, clinicians. Lean on your expertise. See yourself as an expert in what you do, because you absolutely are. Even if you're pre-licensed, you still have expertise, you still have supervision, and you're still growing. And even though you're still growing, you still have the ability to say, hey, based on this, and this is what I think is going to happen. Am I saying to just think these possible scenarios up in your head and then give them to them? No. If you don't feel confident in it, there's a reason behind it. So if you're not feeling confident to give people prognosis or talk about what could happen, it might be because you're feeling insecure about the base of knowledge that you have. And so my suggestion is to start reading. Follow, subscribe to me, because I'm going to start giving you there's going to be lots of information coming to you guys. And I'm so excited about this YouTube channel, because I think it's so needed for clinicians and people who are dealing with a lot of trauma in their practice. But start following clinicians who specialize in this stuff. Start reading. Even the magazines that come from CAMP have some really great information. I read something the other day on prodependence, which is super awesome because they work with people with borderline personality disorder, and it was awesome. Anyways, or start just looking at Psychology Today. Read the articles. Go on Wikipedia, and on the references, go down to the references pages and click those references. Read the articles where people are getting information. And that's how you start to build this base of knowledge. Does it take time? Yes. Do you have to be passionate about what you do? Yes. Should you could even use your extra time from work if they make you sit in the office. If they make you sit in the office, start doing a lot of research there. Make yourself a list of references so you can see your own base of knowledge start to grow. And you start to grow confidence in what you know and what you do, and you start to form an identity as a clinician and as a trauma-informed clinician that gives you the ability to go confidently into the room with a parent or a caregiver and start to talk about the effects of decisions and parenting and all of that good stuff. So this was Kristen Martinez. Subscribe to me. You're going to get good information. You'll also get some silly stuff and some random stuff, but whatevs. That's who I am. So follow me, and you can catch me on Facebook, Chrissy Martinez. If you're a friend of somebody who's friends with me, you can find me. If not, you can't. You probably can't find me. And you can find my private practice online, Pax Therapy and Family Services. And we're a small group practice in Whittier, but we specialize in adult survivors of childhood trauma, high-risk teens, and borderline personality disorder. So that's us, Kristen Martinez. Subscribe, keep informed, and I'm really excited I'm going to be starting to post some interviews about privilege and oppression, interviewing different people about their own experience in the therapy room and how to address, and I have a cool tool to help us address privilege and oppression early on in treatment with our clients. So stay tuned. Bye.